how could I? I wasn't breathing. I literally couldn't catch my breath. Don't sleep flat. I can't sleep flat. It's almost like this weight that just doesn't allow you to feel that you're breathing properly. I actually had a consultant tap me on the back and say, if there was anything wrong with you, I wouldn't be sending you home. I don't think I lasted through the night, really. I think at that point it was an ambulance. It was only performing or pumping blood around my body to the heart function level of 10 to 15%. But the word heart failure, when I did start to think about it, just thought, well, that's the end, isn't it? When you have a heart condition, quite often you are always having to explain why you can't do something. Yeah. You've actually got a community of people that really do understand.
Welcome to the Pioneer Inpatient podcast. I'm Michael George of Sages Healthcare Consulting. This episode is brought to you in collaboration with Global Heart Hub, the international alliance that provides a voice for those living with and affected by cardiovascular disease. Now, can I start by saying it's great to have sisters, and hello to Bridget, Rachel and Sarah, my three sisters. My 59-year-old guest would also say that it's excellent to have a sister who is also a nurse, her nurse sister Maureen. She helped her through and advocated for her when she went through her own healthcare crisis in 2011, 2012. Yeah. Now, she's certainly paid back by becoming a powerful advocate as a change maker for Cardiomyopathy UK. I welcome to the podcast Marcia Malcolm. Marcia, welcome to the podcast.
Oh, thank you. Thank you for having me.
Oh, it's great to have you here. So let's start by you giving me a little potted biography, 45-second, let's say, biography of Marcia Malcolm, please.
Yes. Well, indeed, I'm 59 years old, 60 next time round, so I'm looking forward to that. And it's been a bit of a difficult one, but it's not surprising because in my life I've always had to just do a little bit more. Ended up being a single parent when I was about 24, grew up my son, worked full time, tried to do as much contracting work as I could so I could take time off if I needed to. Mm-hmm. And so, yes, had a busy life, went on holidays, did all the things that one would want to do to be happy and live a fulfilled life. But yes, things obviously changed later on.
Exactly, but just to say, sometimes people associate cardiovascular disease with bad quality of life, but you were fit and active and you did a lot of sport in your youth, didn't you?
Yes, I did. From secondary school, in fact, I was in the athletics teams. Whenever we represented our South London schools, because it's South London school that I went to in London, athletics, 100, 200 metre sprints, involved in the relay, even learnt discus throwing. So it was, a really, really busy time. And so rehearsing and practicing and doing all school championships. And even in my adulthood, I was in an adult netball team. Mm-hmm. Again, taking on from when I left school, doing similar. And apart from swimming, I can't really swim, but I did all those sort of sporting activities, even boxercise and Zumba classes, all that sort of thing. And I was quite active for a while.
That sounds very good. So you started having really gynaecological issues to start with. Yes. So you had uterine fibroids, you had hyperthyroidism, yes, and anemia as well. And so actually you associate cardiomyopathy with thyroid issues and anemia. So did anyone suggest at this time there could be a link with a heart condition?
No, it's something I found out subsequently, just through discussions, maybe even going to the cardiomyopathy conferences, maybe some of the subject matters that have been brought up on the Global Heart Hub webinars that they have, and it's made me want to look into it even further. But when I think about my cardiomyopathy and I think about the things that could have caused it, it's like a tick. Yes, that's me. Tick, that's me. So anemia, untreated anemia or severe anemia restricts oxygen to your bloodstream, and that subsequently can cause damage itself. The thyrotoxicosis that I was in when I was having palpitations and fluttering and high temperatures and tremors and all those things, and maybe even the tablets that you get to subdue some of those issues were maybe hiding other things maybe for a while I had the white coat syndrome. I don't know if you've heard that referred to. Like
people say.
Yes, they say there's a syndrome where you go to a medical environment, they take your blood pressure and it suddenly starts rising. And that's happened a few times for me, and maybe I got away with saying, oh, it's not that, it's because I'm in pain, why it's high, or it's white coat syndrome. Yeah. And I think it was believed because they look at me and think, well, she doesn't look like someone. Yeah. Not that there's a look, but maybe, there's nothing in it. Mm. So it was never pushed through or further investigated.
Yeah. So, and then you had treatment for uterine fibroids. They were removed, and you took time. This is September and December 2011.
Yes.
You took time off work. You're still only 45. You're fit and active. You're taking time off work. All should be fine. But when you go back to work, things go downhill very quickly. You're going for a bus, yes, and you end up having to call your sister Maureen. So tell me more about this.
Yes, maybe I went back to work too early, and I should have rested a bit longer. But I felt like I was ready to rev and carry on. But I was having a bit of sleeplessness and feeling tired and quite lethargic. But I've often felt like that and just pushed through. But this particular evening, I was on my way home, and it was a winter's day. But I remember thinking, oh, I feel like, the air is just pushing me back a little bit. I felt like I couldn't walk and talk on the telephone, on the mobile at the same time. And this went on for about 10 or 15 seconds, and to the point that I had to end the call. And I said, I'll call you when I get home, or I'll call you when I'm on the bus, but I can't do the two things at the same time. I feel out of breath. So my sister, being a nurse, was thinking, well, she didn't have a cold, she didn't have a flu before. Mm-hmm. There's something in this. By the time I got home, she was already there. Really? She said, what's this about you not being able to breathe properly? And that was it. We're going to the hospital. Yeah. We need to get this looked at. Bearing in mind that I'd had these embolization procedures, yeah, 2 of them, because the first one didn't work. And then I had to go back again because the fibroids hadn't shrunk. Yeah. So, went off to the hospital, and yes, that's where things started to change.
So what were they then telling you there when you arrived?
Well, they were first saying that maybe I'd caught a virus, because I had travelled about 3 months prior when I had the first procedure, and maybe it was a viral infection, but not many tests were done towards that, referred me to maybe go back to my GP, how could I? I wasn't breathing. I literally couldn't catch my breath. I couldn't take in fill my lungs with air. My sister said the golden words that now is infamous when I even go to the doctor. I say, humour me. And she said to the junior consultant, she said, humour me. She said, give her an X-ray. Yeah. This is not normal. This is not my sister. She hasn't got asthma. Yeah. She's never had this problem before. And I think he looked at her and thought, oh, I can't mess about here. She's a nursing sister. So I did get an X-ray, and I remember someone saying to me, you're going to be with us for a few days. Turned out I had a pulmonary embolism. Yeah, wow. So my lungs. And I was in hospital for 4 days, just before Christmas and till around Boxing Day. Yeah. Yes.
So then you come out.
Yes.
It's Christmas period, a time of supposed peace and celebration and joy, but it's anything but that for you. No. You could hardly even sleep, could you?
No. That was the start of my almost sitting upright to sleep. I still almost do that today. I don't sleep flat. I can't sleep flat.
That's associated with cardiomyopathy, isn't it?
It is, yes. This feeling when you've had, as I'll explain, heart failure. And that's something that happens if you have fluid building up in your lungs and in your body and things like that. It's almost like this weight that just doesn't allow you to feel that you're breathing properly or that you can lie flat. And that was my diagnosis. I came out of hospital with the medication, INR clinic that I'd have to subsequently go to be treated with blood thinners to get rid of the clots. They'd done it in the hospital, but now I had to continue for about 6 months taking it. And 2 days later, I was still at home, still couldn't breathe. Yeah. I was thinking, they've treated me in hospital, they've done all these things, why can I still not breathe properly? I couldn't leave the house, I didn't feel like I could go anywhere. And my sister stepped in again and she said, we're going back to the hospital. I said, I've just come out. She said, no, I don't care, it's New Year's, we're going back to the hospital. So she came and got me, and we went to the hospital, A&E, clinical decision unit. I was referred to them, and we were there for hours, absolute hours. And I don't know if they needed the beds or what it was, but after doing some tests, they didn't think anything was wrong with me.
Really?
I actually had a consultant tap me on the back and say, if there was anything wrong with you, I wouldn't be sending you home.
So you were sent home again?
I was sent home again. And I remember I had palpitations, flutterings, I was hot, I had headache, I had just generally feeling like if I lay down, I probably wouldn't wake up again. I was so tired, so lethargic. My sister did most of the speaking. I couldn't even speak up for myself, and I can normally speak quite well for myself. And she tapped me on the back and said, look, we'll speak to gynaecology, we'll speak to the thyroid clinic, because by this time I'm feeling bloated, my stomach's out here like I was pregnant. I could feel fluid around, I couldn't wear anything on my fingers. I was swelling up, my ankles were swollen, maybe even my face was puffy. But no, there's nothing wrong with me, we're sending you home. It's probably the result of the operations, and probably because you're on medicines for the thyroid.
So you're sent home again. What happens next?
Well, I don't think I lasted through the night, really. I think at that point it was an ambulance that had to take me into hospital. And, you know, you were just here. We looked at your records sort of one following day. And again, my sister saw someone that she maybe trained with at another London hospital, a big teaching hospital. And she said, explained to him what was going on. He says, oh, I think what she needs is a echo, a 3D echo. Let me see what I can do. And he arranged that. So the clinical decision unit, they sent me off for this scan. And then I heard the words again, you'll be with us for a while. And I'm thinking, gosh, how many hours do I have to sit here waiting? And at that point, he said to me, you're in heart failure. Your heart's enlarged.
Wow.
And we're going to have to refer you to a cardiologist. And I think you've got dilated cardiomyopathy. But your heart's enlarged and you definitely, it's not functioning very well. I didn't learn from him, but when I eventually saw a consultant, it was only performing or pumping blood around my body to the heart function level of 10 to 15%.
15, that's serious heart failure.
Severe heart failure. On top of that, it was severe mitral valve regurgitation. So there was a loud, audible murmur that no one listened to throughout this time, and no one heard until that particular scan.
So you've got a cocktail of 3 severe, serious heart conditions: cardiomyopathy, mitral regurgitation and heart failure. But 3 weeks or a few weeks ago before that, people were saying it's a gynaecological issue.
Yes, the fluid, the feeling bloated in my stomach. Oh, that's the fluid. You know, when we have the embolization, we have to fill your cavity with fluid. So sometimes it takes a while to come out, but just keep drinking fluid and it will come out. But the more fluid I was probably drinking was probably not the greatest thing to do, because it was related to something else. And maybe the PE triggered it. But even being treated for the PE, no one did an ECG. No one did an echo scan. Maybe not the right bloods were taken. So 3 hospital sessions, being under 2 different clinics. And no one saw that.
And when you were finally told your diagnosis, had you ever heard of cardiomyopathy, mitral regurgitation before? What did it sound? Must have sounded like Greek to you when people said
gobbledygook. Yes, and my sister obviously, when she heard those words, she probably knew. Well, she did. She knew what all of those things meant, and so I remember, family members coming and my son being told to come, and I didn't know the seriousness of it, to be honest. just the fact that I'd heard the word severe, but the word heart failure, when I did start to think about it, just thought, well, that's the end, isn't it?
Yeah.
That's what it suggests, if your heart's failing, there's nothing left, because we all have a heart and it don't function without one. So that's what it meant to me at the time.
And you were fortunate then to come under a cardiologist, Professor Carr-White, who is an expert in cardiomyopathy, an expert in heart valve disease and heart failure at St Thomas's. So how did that help you and change things around?
Yes, I mean, at that point, it was like everything was aligning. I had this terrible entry into this diagnosis, and at the end of it was this specialist who not only was a cardiac consultant, but specialised in all the fields that mattered to me in that moment. And he was able to explain. And not that I understood everything completely, again, because I was so shocked I was being given all these different medicines, suddenly on all these tablets. But it started to make a bit more sense. And it was positive, because he said, we're going to see what we can do. We're here to help you. We'll try you on medicines first. If that doesn't work, then we'll look at maybe a device or surgery. But this is what we can do for you. But at the same time, I was aware that they'd already spoken to maybe my family and saying, well, if we can't help her, we may have to consider surgery or a heart transplant if things get worse. And we'll have to do an MDT, which is a team meeting of all departments to discuss whether I needed the mitral valve surgery. But at that time, I was too weak to do anything. And we've already seen that I've had a problem after anaesthetic with the two procedures. So it probably wasn't looking good if I had to go down that road.
So as you say, you could normally have a heart transplant, mitral valve replacement. But until now, it's been managed through medicines and lifestyle, or what is it?
Yes, a combination of the two. Still working on the lifestyle, because I do feel sometimes I don't have a good hold of my level of exertions, and sometimes I limit myself because I'm too scared to go overboard a bit. So I'm trying my best, doing a little bit more walking, and going back to do cardiac rehabilitation very shortly, I think next month. I did it very early on, but now I understand more about my condition. I think it will be even more beneficial this time round. But yes, it's all just been a combination of medicines. They've changed over the years, over that time, but I'm on probably 3 or 4 of the best medications there are for patients with heart failure and cardiomyopathy. So I'm very grateful to my cardiac team.
To the cardiac team?
Yes.
Professor Carr-White also puts you in touch with Cardiomyopathy UK, which you've described as a lifeline for you. What do you mean by that?
Yes. Well, I think it saved me, because there was a point where, my employer didn't understand. I had to think about, you can't perform at 50% for us. We don't need you. So yes, it was, having to think about coming out of a career that I enjoyed, private equity. It was very busy doing marketing and organising big events and things like that as well. So it was a big change for me and something that I had to adapt to, but it left you feeling less confident than you were in the past. You felt like you was constantly having to explain to people, because it's not visible. Heart conditions, you can't look at someone and think, gosh, they've had a heart defect from a child, or this scar, I can see it. You can't. And so when you have a heart condition, quite often you are always having to explain why you can't do something. So, flying into different places, if you have assistance, you probably sometimes look at them and think, well, what do they need assistance for? And then you realise someone maybe can't climb the stairs to an airplane because they've got asthma, or all of that is of great exertion for them. So, just a better understanding would go down a lot better for most of us.
So you're saying that you actually had to give up your role you loved because of your heart condition?
Yes, I did, and even trying to do other things, it wasn't quite the same. But you always had to explain yourself, and as soon as they realised you had a heart condition, it was I don't think it's still very much understood by employers. So, yeah, anything campaigning-wise that I can do in the future around that, educating, I would probably be first in line to do that.
And you said to me that even today you sleep sitting up.
Yeah.
I imagine when I have a bad night's sleep, I think terrible at work the next day.
Yes.
But this is every day for you.
Yeah, and I wouldn't even try to lie flat because that feeling that I had then, I wouldn't ever want that to happen. And you do jump out. It makes you jump out of your sleep. So if I move about or I feel like I've slidden down the bed, I automatically find myself jumping out of my sleep, and I do. I'm a very light sleeper now. I can wake up if a pin drops. So yes, it's a big change.
And coming back to Cardiomyopathy UK, what's that sort of peer-to-peer support giving to other patients?
I think this has been wonderful. I mean, they're the national charity in the UK for all heart muscle conditions, Cardiomyopathy UK, and they offer support not just to the patients themselves, but also to family, carers. They even offer education to healthcare professionals so they can learn more about cardiomyopathy. They do a lot of research. They conduct surveys and focus groups amongst the patients, families and carers, so they understand a lot of what we go through, and they provide peer support. We have different group meetings. If you have hypertrophic cardiomyopathy, there's a group once a month or every 2 months. You can go online, sometimes they're in person, and they have that for each of the cardiomyopathies. And they also have things, general ones for devices and management, maybe pharmacy. They have a 24 and a helpline. It's not 24 hours, but a helpline with a nurse at the end of it. So if you have any questions, and now they put together a glossary of terms. You get your hospital letter and half the words you don't know what they mean. They have a glossary. And they offer in-person meetings, and they have wider groups all around the UK, not just in London. So they have Scotland and Ireland served as well. And they have team leaders, so they've been trained to volunteer and be team leaders, and then they start groups wherever they want to. And now they also help with well-being and psychological aspects, because a lot of people get lost in the system, and sometimes you need even welfare and knowing your rights, because insurance can change, and so many different things that you wouldn't think of are things that you have to consider when you've had a diagnosis of cardiomyopathy.
And you are a change maker for Cardiomyopathy UK. What does that role involve?
Well, it was through the many meetings that we used to go to that this was offered as an opportunity for those who wanted to help raise awareness for cardiomyopathy, but also challenge the decision makers. So an opportunity to get in front of stakeholders, whether that be in your local authority or in your hospital trust. So joining my local GP, patient participation group, I started there, and joining more nationwide groups, so global heart hubs, so you can collaborate and partner with other organisations that all are shouting from the same hymn book. We just want cardiovascular disease, we just want heart disease to be on everyone's agenda when it comes to looking towards change and making the world a better place for those people with conditions that affect the heart.
So you're doing great advocacy. If I were to say to you, you had the chance to go before policymaker, health minister, and were able to say there's 2 or 3 things you particularly want, what would those things be?
I think screening. I think there should be a campaign for screening. At the moment, you have prostate screening, you have cervical screening, you have breast screening. They all happen at certain times in a person's life. As I keep saying, we all have a heart. So if we need people to think about what they can do, I would say screening programs, or better still, the medical profession. There's things that they can do if they haven't seen you for a while to actually screen you quite quickly to see if there's any early signs of illness, because surely prevention's better than trying to cure something once it's already here. Yeah.
Absolutely. And just to say that we have a great guest in Marcia here, and we can bring more patients to you if you subscribe. So please hit the subscribe button so we can bring Marcia and many other patients. Thank you very much for that. Thank you. Marcia, looking at it, this is a story I hear often on the podcast about women being misdiagnosed, or there's a misdiagnosis, and that's happening in your case. So what do you think is going wrong? What should be done to put this right?
I think it's past experiences, and I think maybe the textbooks that people are trained with, and that you're supposed to present in a certain way if you're having a heart attack, if you've got an infection, and sometimes they miss out actually looking at the individual person and listening to the individual person. And I think especially with cardiovascular disease in women, our symptoms will be slightly different from those of men. I still read articles now where if people had the choice, that it would be difficult for them to resuscitate a woman. Really? You know, so because again, to put those paddles on somebody, they would have to remove their outer clothing, and they wouldn't want to be at risk of being told that they've done the wrong thing. We have to change those attitudes, because I don't want to be woken up and realise that this was a choice that someone had to make, and it wasn't something they freely felt they could do. And you'd be grateful if someone saved your life, yes. Surely. You wouldn't matter if you know, for a little while that you had to be exposed. But even those differences, how you put a paddle on someone if they've had a cardiac event. And so those attitudes need to change, I think. But just take a family history. Sometimes there's familial reasons why these symptoms are happening to you. Maybe there's been sudden death in the family. Younger, you know, your uncle or aunt died very early in life and no one knew the reason, but they collapsed at work. That could be an early warning sign that there is some sort of familial link. And so even just taking a family history, a medical professional doing that on your first appointment, could actually establish some ways in which you can prevent, rather than trying to react, yes, once a diagnosis has been made.
Absolutely. Now, we're supported here by the Global Heart Hub, and one of the themes of their work is Unite for Action for Women's Cardiovascular Health. Yes. Now, as a woman, as a patient, as an affiliate to Cardiomyopathy UK of the Global Heart Hub, how important is the association with them to you?
Oh, very important. I mean, Cardiomyopathy is a UK national charity, and so it helps a lot of people in the UK, and they do have their Facebook page and social media, so other people with cardiomyopathy can be linked to them. But Global Heart Hub is bringing us all together under one umbrella, and we've all got a cause around cardiovascular disease, and there's so many of the charity's work that is around bringing equality to healthcare. And so by collaborating on this level with Global Heart Hub, and there's the organisations under which they also support, it means that we're really all got the same voice, different causes, different places. But if we can get to a point where cardiovascular disease is seen as this preventable condition in some cases, and if detected early, it can be treated well, I think we're on to a good start. So Global Heart Hub is really laying the foundation for collaborative thinking and working.
Excellent. So, and now you're 14 years on from your diagnosis.
Yes.
3 conditions.
Yes.
How are you managing it now, and where do you see the next steps? How have you been discussing it with your cardiologist?
Yeah, well, still continuing on medication therapy, which has worked quite well for me. I've had fluctuations in my heart function, so no longer the 10 to 15% where I was in a severe state. It's more mild to moderate, even rising to about 45 at one point, about 5 or 6 years ago. But maybe with the stresses and strains of the world as it is now, it's dipped a little bit. Yeah. And so hence the changes to my medication. But I feel I'm on a good combination now, starting to feel more energised. And so this 35 ejection fraction, I hope will be increased as a result of these new medications. So doing well.
We certainly hope so. We certainly hope so. Now, sometimes if you have a diagnosis like you have, threefold, it can seem terrible. But can I put it to you that also it gives you, because you're part of Cardiomyopathy, because UK, you're a patient advocate, it actually gives you a new community. You've been able to do things that you wouldn't have done if you hadn't had this, what seems like a horrible diagnosis. How has that actually helped you and changed your life?
It's really helped me and change my life. I thought I was confident before, but I have to admit when I had to give up my work and I wasn't working for a while, you do lose that confidence. You feel that you're not worthy, but that you just felt down on yourself and you didn't know what the future was going to hold. And I didn't know anyone else for a long time that had this condition. I'd mention it and they looked blankly at me, still didn't know many. And suddenly this whole world, through Cardiomyopathy UK and through Global Heart Hub and all the things that I've been able to do, you've actually got a community of people that really do understand. They either through their own experience, looking after somebody with it, or just having someone in their family with it, or running an organisation that's helping people with another condition. So with Cardiomyopathy and Cardiomyopathy UK, I just feel as if you're not on your own. You're definitely not on your own. You've got people that can see you, they can hear you, we support each other. If I'm going for, I had to have an angiogram once, and I was able to go on our coffee and chat. We have a coffee and chat on a Friday afternoon, and it's still online at the moment, but everyone joins. We even have a gentleman join us from Canada. And I was able to ask for support there. Has anyone had one? Yes, they said, and they were able to tell me what it was like for them, what to expect. And so having a more frightening image in my mind, what it would entail, actually having had that discussion and having the procedure, it was much the same, much of what they had said. So that advice that we can offer each other, that support, you know, we know when people's children start school, when their birthdays are, it's become like an extended family. And I think that's what being a change maker and doing the advocacy work is. It's like you're part of a family that understands you.
Marcia, thank you very much for sharing your story. It's been a privilege to us, and thank you for all the great work you're doing with Cardiomyopathy UK as a change maker.
Oh, thank you for having me.
Thank you for that. So thank you very much. Thanks to Global Heart Hub, the International Alliance, which provides a voice for those living with and affected by cardiovascular disease. Marcia said we need equality in healthcare for men and women. Do you agree? How do you think we can do that? Please leave your comments at the end of the show. I'd love to hear that. Please remember to subscribe. Hit the subscribe button now. That would be great. So thank you for watching. And finally, please remember to take good care of your health.